Hi, I'm Dr. Anita Marsden and I'm a clinical psychologist, and I'm here today to talk to you about the window of tolerance. All credit for this construct goes to Dan Siegel, neuroscientist, and he talks about this concept in one of his books called The Yes Brain Child. So go and check it out if you want to find out a bit more about it. Okay, so before we start, I just want to say that when thinking about behaviour in our children and young people, one fundamental principle is that all behaviour is communication. Whether they're having a tantrum or back chatting, or whatever they're doing, they're trying to communicate something with us. And actually, if we think about ourselves, our behaviour is often communicating something to our partners or our friends when we might not have the words or the ability to really communicate that verbally. Okay, so the window of tolerance is a way of understanding emotional regulation. And the reason I'm sharing it as a tool in this toolkit is that it can really help to bring an understanding, that it can help to make sense of what's going on, and when we're able to make sense of it, it doesn't feel so worrying anymore. That real idea of let's name it to tame it. When we name something, when we name what's going on, we don't feel so bothered by it anymore. And actually, although I'm putting this video in the parenting unit, sort of understanding children and young people, this can help to bring an understanding to our own emotional regulation, to all humans' emotional regulation as well. And at this point, I think it's really important to say, although we're talking about sort of building a window of tolerance and being able to be balanced in our emotional regulation, it's a really normal part of being human to get distressed and to feel emotional distress, and we wouldn't want to stop that either. That's absolutely normal. So I guess the aim and what we'd like to experience with ourselves and our children and young people is more periods of emotional balance, where we're feeling kind of calm, or we can experience some distress, but we're not feeling completely out of control. And actually, I think it's really helpful to say that at this point in time where things are really unusual and we're experiencing a lot of change in our day-to-day lives, that I would expect to see more tantrums and more emotional distress both in our kids and in ourselves. So I'm hoping that this will be really helpful in thinking about that. Okay, so so I've said the window of tolerance, and I'm just going to sort of describe it now as an idea designed by Dan Siegel. And it's really trying to kind of explain our autonomic nervous system and what happens in our nervous system when we get distressed. And I know Dr. Kat Gardner has done a video about the kind of like our anxiety signature and talked a lot about physiology of anxiety in there, and this kind of builds on that a little bit more. So our autonomic nervous system has got two branches: the sympathetic nervous system, which is a bit like our accelerator, it gets us going. We'll see an increase in our heart rate, our breathing, our muscles get tense. And we've also got that parasympathetic nervous system, and that's that kind of brake, that's the brake part of our nervous system, where we see a decrease in our heart rate and breathing, and our muscles kind of loosen up a bit. Now, in the window of tolerance, we've got kind of three levels, three zones. And so the green zone is where we are feeling balanced, okay? And there's really a balance between those two parts of our autonomic nervous system. So our sympathetic and our parasympathetic are working well together, and actually they're activated every time we breathe. So when we breathe in, we activate our sympathetic nervous system, and when we breathe out, we activate our parasympathetic nervous system, which is why breathing techniques can be a really good way of bypassing that emotional distress and making that kind of really old part of our brain that we talked about in the hand brain model, that kind of reptilian part of our brain, feel soothed. Okay, so elongating our out breath is one way of engaging that parasympathetic nervous system, of engaging the brake and slowing things down. Okay, so in the window of tolerance, in the green zone, where our autonomic nervous system is balanced, we're feeling in control, we can be flexible, we can sort of handle ourselves even in some adversity. We might make good decisions, we're feeling engaged, we're receptive to learning. You know when we're kind of able to feel balanced, okay? And then we've got the red zone, okay? So the red zone is really demonstrating our fight and flight system, okay? And that's when we've become chaotic, okay? We've flipped our lid, okay? This is when the higher cortex, and if you haven't seen the hand-brain model video, go and check it out. We flipped our lid. Our old reptilian emotional system of our brain is really in charge, and we're in fight or flight. So we are chaotic, okay? We're feeling sort of intense fear or anger, frustration, embarrassment. This is hyper arousal. So physiologically, our heart might be racing, our muscles are going tense, and we won't necessarily see these signs or symptoms in our children and ourselves. We might see some kind of flushing of cheeks, but inside there are those physiological activations that are happening. Behaviourally, what we might see is hitting or kicking out or shouting or swearing or running away, actually escaping the situation. I think what's really important to say is, again, if you've flipped your lid, if our children have flipped our lid, this losing of control is not fully under their choice. They're not choosing to do this, and therefore a kind of punitive response to that behaviour wouldn't be appropriate because they're not in control, okay? And actually, in terms of strategies, what we need to do first, if they've gone into this red zone, is to connect, to help them to regain emotional balance. Okay, and I'll come on to that in a minute. I'm just going to talk about the third zone. So down here we've got the blue zone, and this is our freeze zone, okay? So this is more when we're kind of shutting down, okay? So in this zone, what this might look like is withdrawing. So not necessarily running away, but sort of withdrawing, going very quiet, very still. And what's happening here physiologically is actually the heart rate is lowering, our blood pressure is lowering. We might see sort of lower eye contact, and it's hypo-arousal which is going on here. And to a very extreme, and some people might experience this during very traumatic situations, we might completely faint or utter kind of losing control. Okay. So I've already said that we don't choose which state we enter, and you might find a bit of a pattern that you know of yourself, that you either go into that fight or flight kind of real hyper arousal, or you might know that you're somebody when triggered that actually kind of gets a bit dampened down and goes very quiet and needs to withdraw. And again, you might see those different patterns, and you can look out for that in your children. Which zone do you think they go to more often, and are there some situations which make them go to the red zone more often and some situations which make them go to the blue? Okay. So we've already said that one reason for sort of sharing this is that idea that by understanding what's going on a bit better can help to for us to feel a bit more like we know we're in control. And I think, like I've said, that actually because we know that what's happening here when we've left our window of tolerance, okay, and I know I've sort of said this is the green zone, but this green zone is our window of tolerance. is that what we need to do, because if we've left our green zone and we are in the red or the blue zone, we've flipped our lid, there's no point, like I said in the hand-brain model video, there's no point doing that rationalizing, trying to talk, trying to use thinking and reasoning as strategies with our children at that point. What we need to do first is connect. Okay, so if they'll allow us, we need to hold them, to soothe them. Perhaps they won't let us get close at that point, and that's okay. And lots of children won't when they're that distressed. So maybe we just need to sit near them, to just create that space, to hold that space for them to feel that distress, but we're with them. Okay, and the message that we're giving them, and the message hopefully that they're receiving, is that I'm with you in your distress. Okay, and this is very different, I guess, to a quite standard strategy sometimes when children have a tantrum or behave in what we might consider a negative way, which might be to put them in a timeout. And I guess sometimes, or a message that a child might receive if we do that, is that we can't be with them until they behave appropriately, or that we're abandoning them. Okay, and that can be really difficult, especially because when a child goes out of their window of tolerance and when they lose it, they flip their lid, it can be really scary and frightening for them. I don't know about you, but I know when I've lost it and flipped my lid, that's kind of scary. It's not me in control, it's my animalistic part of my brain. So that in and of itself feels scary. And actually what I want at that time, when I think about what my need is for someone to hold that space for me, just for someone to be with me in that. So that the first strategy, I guess, is to connect, to hold them, soothe them, listen to them, empathize with them, validate. You can use phraseology like, you look really cross right now, you're really angry. You could even name the emotion for them, like we said, name it to tame it. Some children find that very frustrating, so I'd use that carefully. Younger children find that perhaps a bit easier because you're helping to build up their emotional literacy, their emotional vocabulary. But really what you're trying to do is help them to feel safe and loved. And I think Alfie Kohn, who's a really amazing sort of parenting practitioner, he's probably got some other title, but he talks about, it's not really about what you're doing or what strategy you're using, it's about what message is being received by your child. And that's really hard to be in control of, but I guess you can check that out with them afterwards, perhaps when they're back in their window of tolerance again. So I guess, if our child's flipped their lid or they've left the window of tolerance, and what we're using first of all is that strategy of connecting, of helping them to be soothed. And I'd say don't be afraid of feeling like you're reinforcing the behaviour. I think really if a child has genuinely flipped their lid and they're out of their window of tolerance, to connect with them first is going to probably help them to get back in their window of tolerance quicker. Okay, because you're co-regulating, you're helping them to regulate. What you can do then, I guess, is once they're back in their window of tolerance and they're soothed and they're back in control, they're more flexible, you can see that they're able to listen and be engaged. You're pretty sure that their higher order thinking, their reasoning is back online, is either straight away, if you think that's appropriate, or even an hour later, or even the next day, depending on their age and developmental level, is talk to them about what happened. Okay, so you can talk to them about maybe why their behaviour before they flipped their lid wasn't okay or wasn't appropriate, and you can kind of problem solve with them as well. You can think, well, what could you do next time, or how could I support you, how could I help you? And I think what's really amazing, and I actually have a quote, but I've left it over here. And Dan Siegel talks about how the word discipline has been sort of misused, that it actually means, it comes from the word disciple, to learn, to teach. And there's a quote from Benjamin Franklin, and it goes like this: tell me and I forget, teach me and I remember, involve me and I learn. And I found that really powerful, because I think a lot of the time I'm in this struggle between wanting to be in control as a parent and wanting my children to be good, to do what I ask, to do what I say, and sometimes finding myself saying things like, oh, you just have to do that, I'm the grown-up. And actually, kids want to know why. And the more we can help them to understand the rationale for why we want them to behave certain ways, why we want them to make certain choices, the more likely they are to make those choices on their own when given the chance. Okay, so I think I've said most of what I wanted to say about the window of tolerance. There's probably lots that I've forgotten, but I hope that it's been really interesting and helpful. And again, there are further strategies. This is the last thing. There are further strategies that I would like to share in terms of how we can broaden our window of tolerance, okay, and how we can get back into our window of tolerance. So there are two kind of lots of strategies. One lot of strategies that we can use when our kid has flipped their lid, and I've talked about connecting, and that really is the main one, but there are some others as well, so that we can get them back into the window of tolerance quicker. And there are also strategies that we can use which are about kind of preventative. So I guess you've got reactive and preventative strategies. And those preventative ones are about broadening, making that window of tolerance bigger. And I didn't say earlier, but our window of tolerance can be impacted on a day to day. So I know my window of tolerance is much smaller if I've had a bad night's sleep, if I'm hungry, maybe I'm not in a very good mood, or if there are unexpected changes, things have happened and I have to suddenly adapt. And I'm thinking about at this current time, I'm sure that all of our window of tolerances are a bit smaller perhaps than they usually are when we're able to do those things that help us to care for ourselves and care for our families. Our window of tolerance can also be impacted by more long-term things like a child's age, developmental level, their temperament, their underlying temperament, or whether they have a neurodevelopmental condition like ADHD or autism, or whether they've experienced trauma as well. I think that was all I wanted to say about the window of tolerance. And again, I just want to sort of finish on that idea that there's nothing wrong with emotional distress or emotional expression. And actually, I think it's really important for us to validate feeling angry, to validate getting frustrated. That's okay. It's good, it's healthy, but it's really helpful, I guess, if when we experience those emotions, that one, we can express them. So if our kids are able to communicate to us, hey, I'm feeling really angry right now, that makes it much easier for us to understand what's going on and to offer them some support. It's also easier, I guess, if once they've expressed their anger, or we have, that we can recover a bit quicker. It's really hard and difficult to see our kids in distress for long periods of time. So hopefully understanding the window of tolerance and using some of the strategies that can support getting your child back into their window of tolerance and broadening their window of tolerance will bring a bit more emotional balance for you and your kids. All right, thank you for listening. Take care. Bye-bye.